joining us for today's presentation. And I want to apologize for the video quality. I know it's not as it used to be, but I want us to go ahead and do something very quick. Today we'll be talking about this class is actually supposed to start by 6. So I decided to come up earlier because I have other engagements that actually need my attention. Okay, I want to also thank you so much for understanding. Okay, so now we're talking about secrets for winning over dangerous uh, secrets for winning dangerous kidney cysts. A lot of people in my kidney health class have kidney cysts. And how do they know they have kidney cysts? They suddenly start feeling back pain and lower back pain, of course, and they went to the hospital to seek for solution, and they were asked to do ultrasound scan. The ultrasound scan, they came back with a result that showed kidney cyst. Okay, so and this result actually most of the time is actually devastating for this person, for most of them, and they hold the result looking for someone who can actually interpret the result for them and give them solution. I know of a man I met last 2 years that has what we call polycystic kidney disease, and it was affecting his renal function. So the man was there, not knowing what to do. His stomach was getting enlarged, not knowing what to do. Till he started talking, and solution was actually given to him. So, and I believe that by the end of this presentation, if you're among those who have um, dangerous renal cyst, you will also be getting a solution. So before we now go into the business of the day, I want us to talk. What actually do you think a kidney cyst is? Okay, we have cysts occurring or happening in different parts of the body. Okay, you would have heard about ovarian cyst, you would have heard about um, liver, liver cyst, like cyst in the liver. Okay, this cyst happens mainly on the surface of the kidney, and rarely and sometimes it also happens inside the kidney. So now, what is this? A cyst is like have you seen someone who has a fire burn before? Okay, a fire burn like a burn on the skin of the skin that the place will be swollen, and I feel like it's fluid like presence inside that stuff. Like someone who got burnt by iron, okay, or exhaust. Discover that there is a swelling in that person's body and it has a fluid inside. That is exactly how a kidney cyst look like. So now, if you have kidney cyst, it could be what we call it could be if you have a renal cyst, it could be simple cyst or it could be polycystic. Okay, like what I said. I said it could be simple cyst, and it could also be what again? Polycystic. Polycystic is also known as multiple cyst. So simple cyst means that the cyst you're having is just one. Okay, so the cyst you're having is just what? Is just one. Please, I'm sorry for the for commenting and for telling us that. So I have to actually increase my voice so that you hear what I'm saying. I don't know if you're hearing me now. Okay, so now we're talking about cyst, and I've seen someone who has a burn from exhaust pipe or from an iron. So that the place will be swollen and there'll be a sac containing fluid. Something like that is actually what happens in the kidney. Okay, so now I now say that this um, cyst can actually happen on the surface of the kidney, and it can also happen inside the kidney, but mainly it happens on the surface of the kidney. Thank you so much for pointing out that about the volume, and I've increased my volume, and I know that we're going to get the best out of this teaching today. So like I said, we have multiple. The cyst is just one. Okay, when someone has just one cyst on top of the kidney or anywhere around the kidney, remember that the cyst is just one. So now when the cyst is more than one, that is only when it is known as multiple what? Multiple cysts. So the cyst, it becomes polycystic, and when it becomes polycystic, it can actually cause the kidney to do what? To enlarge. And when we talk about polycystic kidney can actually affect just one kidney, and it can also affect both kidneys. Okay, so and polycystic kidney is one of the kidney diseases that runs in family. What did I say? I said that polycystic kidney disease is one of the kidney diseases that actually runs in family. It means that it can actually be inherited by a child from the what? From and it's actually a progressive condition that if you have polycystic kidney disease, it is actually very important that you maintain close tab with your doctor or with your nephrologist who is going to actually help you handle this condition and let you know when to. So someone who has polycystic kidney, if not properly handled, this person could actually um, get into to a point where they'll be needing dialysis. So, but the truth is that we're not talking about dialysis, we're not talking about how it's going to lead to dialysis, we are talking about how you, who is struggling with polycystic kidney disease, can actually overcome this condition. If you've joined us earlier, you'd have actually known that I said something about being that some people who come to me with the result that they have that you will have if you have polycystic kidney disease, back pain. And most people mistake this lower back pain as kidney stone or kidney infection. So the only way you're going to know that what is actually wrong with you at the moment is actually a diagnostic investigation that is going for MRI, CT, or an ultrasound scan. So these are the ways you can actually differentiate if what is happening to you is simple renal cyst, if what is happening to you is polycystic, if what's happening to you is just kidney infection, if what's happening to you is just kidney stone. So now let's take, you've done your MRI, you've done your CT scan, you've done your ultrasound scan, and now you've known that this is actually what is going to be. Okay, I want to use this medium to actually announce to us that very soon we will start doing in care services, we will start running diagnostic investigation for people. Okay, meaning to say that we will have our own scan machine where you can actually walk into our facility and your kidneys will be properly checked. The reason why most people actually get diagnosed wrongly is because one, the facility where they are assessing care, like some people don't have the expertise actually what is wrong with you. But what we've seen that gap in the health sector, seen that gap, that is why we have come to actually help to do what? To bridge that gap. So we are getting our own scan machine very soon where you can actually get accurately what is actually wrong with your kidney or what is actually happening to your kidney per time. A place where you will come, you can actually go for tests, do a scan, be scanned by a professional, and you will get your what? You will get your result instantaneously, and it will really well. So if you're watching this video, I want you to be prepared. By next week, we'll be actually be giving you the actual date where when we'll be starting. I don't know if you're happy for us. If you're happy for us, why not just do something? Why not just tell us congratulations? We are moving ahead. In Vignovas Medical and Kidney Care Services, we are actually doing what? Moving ahead. So now talk about the tests that you should do, talk about MRI, CT, talk about ultrasound, and very important, you also need to do your kidney function test. So this is how things that you need to do primarily. Now let us go into how you can actually win. Okay, so how are you going to win? How do you treat this condition? Because one thing is to know that you have renal cyst, another thing is to do what? To treat this renal cyst properly your life, it will reduce your life expectancy, so it will affect the quality your life or the quality of your life. Okay, so one of the things that you need to note is that if it causes no symptoms, please don't touch it. Okay, so if you have simple cysts or you have polycystic cysts, So the rule is that don't disturb it. If it doesn't disturb you, don't disturb it. Okay? If it's not causing you unbearable, you already live your normal life with it, there is no need of doing what? Doing anything to it. So most people online parade that they have a drug, they have a medication that little money that you have, because this kidney cyst has been proven to have no medical non there's no you can't treat it non-surgically. Let me use that word, non-surgically. Okay, so anyone telling you that they have one magic drug, you discover that after trying it for a very long time, you still come back to square one. So instead of you to gamble with your life, why not go do something that has actually been proven, something that um, um, worked for people and have scientific reality. Okay, so if you're joining us, just joining us, just know that we just did an announcement that we'll be starting our scan. Okay, so kidney, like the machine we actually designed to give accurate reading to your kidney. So if you have any kidney disease, I want you to come to the Novus Medical and Kidney Care Center. You can actually bank on, and it will aid. So now, like I said, if it's not disturbing you, please don't do what? Don't disturb it. So, and if it's not affecting your renal function, please don't touch it. So what did I say? If it's not affecting your renal function, please don't do what? Touch it. Then another thing that you must do in order to be able to win this this battle, one thing that you must do to be able to win this battle is to go for frequent checks. Okay, if you've been diagnosed, actually do to maintain your kidney function test, to make sure your kidney function is joining us. That will be doing also a live video on 4th of on 14th of March. That's next week Thursday. I'll be talking about kidney healthy. So if you have kidney sickness, well, to join this that program on Friday. It's going to be done by 9 a.m. So that on Thursday, that Thursday is actually what. So I want you to join us on that day. I want you to join us, and you will learn a lot of things that will actually help you and help someone. So we're talking about both the prevention, both treatment, and how you can access perfect treatment. Remember that if you are having discrepancies in your scan results, you now have a place that is reliable where you can actually end those discrepancies, and that is at Novus Diagnostic. It's actually very important that you have. That's one of the secrets of winning. One of the secrets of winning is that you have what? A repeated. You have you do frequent um what do you call it? Checkups. Okay, you can start to be checking your kidneys once in 3 months, once in 6 months, once in, like, let it be frequent so that you know what is happening. Because most people who have this condition, most of them go and realize, and by the time they know it, they are rushing them to dialysis, to the hospital for dialysis. That is not what we want. So we want you to actually be there. I'm not saying that when you have kidney disease, that the next thing is kidney failure. No, that's not what I'm saying. What I'm saying is that you need to be proactive enough to take care of your health so that it won't lead to complications. That is why if you have kidney disease, it's actually very important that you do what? Frequent what? Health check, especially the ultrasound scan and the kidney function test. You can be doing it once in 3 months, quarterly, every 6 months, as the case may be. So just do it, and you'll be fine. Now, when you have this thing, and now the pain has become so unbearable, it is actually affecting your kidney function. What are you going to do? Look at what you're going to do. See, we have different measures, different means of doing this. But what I recommend personally is for you to go for laparoscopy. Laparoscopy is actually a treatment where um, some instruments will be pierced through your stomach. The CT scan will help them locate the point where this is in your abdomen. Sorry, not stomach. In your abdomen. I'm just using a layman language so we understand. So it will be pierced into your abdomen, and when it gets into your abdomen, they will now go to the place where this cyst, the little puncture will be done on your abdominal walls. Be punctured. The same way, if you a bone and there is fluid inside, you can actually use needle to puncture it. So that's the same way it will be done in the kidney. Once and um, not to come back again. So we have a lot of people who have kidney cysts that have gone through this procedure and they are fine. And one good thing about laparoscopic procedure is that you do not have to stay in the hospital for a very long time. Okay, it is done today, maybe 3 to 4 days. Essence is that there is no a death sentence. Just follow it up. When it's there, save your money. Don't waste your money on drugs like on looking for solutions that are not there. That's what I mean. So many people will look for solutions that are not there, looking for solutions for kidney disease. They will buy all manner China, India, from all from from everywhere they can source for this. I'm not saying that they don't have good products. No, they have good products that they use for many conditions. But for this one I'm talking about, the best remedy is surgical intervention. And surgical intervention is just a laparoscopy. Not going to cut your body open in this present world, except there's something inside. In this present world, what is laparoscopy. Little opening, like even when you after the procedure, you go home, nobody will even know that something was done. Okay, so that is that for that, and this is the secret of surviving. This is the secret of winning dangerous kidney disease. And when you have dangerous kidney disease and maybe it becomes polycystic and it's affecting your both kidneys, the best thing for you to do is to remove the 2 kidneys. Place this person on dialysis until this person is able to get a new kidney. I'm Monogo Victory, your kidney health coach, and I hope that you enjoyed this section. In fact, if you know anyone who has them, so I'm super excited about our diagnostic center. Please, I want you to start coming in your numbers. If you're watching this video, you've gone to so many places and they've given you a lot of results. Like they've given you a lot of this, you have a lot of discrepancy with your result accurate and reliable that your doctor can actually use in treating you. I want you to always bank with us. Come to the Diagnostic Center and it will be done. Alright, thank you so much. I'm Honorable Victory, your kidney health coach. If you have any question, if you're joining us from our WhatsApp group, if you have any question, you can ask in the WhatsApp group or send a private message to me. If you're not in our WhatsApp group, you can actually request in the chat section and that will be all. Child, I'm so happy that you're noticed at some point to know that you're part of my success story and it's because of you I'm doing this. I would have been tired by now. Okay, thank you so much and God bless.